Good afternoon, everyone. Thank you for having me. Such a pleasure to be here. So I'm Georgio, Channel Manager at Gleamer. In today's presentation, I would like to show you the solutions we have developed, the AI solutions at Gleamer, describe to you our story a bit, and our vision also for the next upcoming solutions. Quick introduction about Gleamer. Gleamer is a French company. Our headquarters is in beautiful Paris, and we've been developing AI solutions for the past 6-7 years now. And in those past years, we were able actually to become one of the leaders in the AI and radiology world. We heavily relied on having many clinical publications to prove the efficiency of our solutions. So we had studies that are peer-reviewed, published in A-class journals like radiology. We also work closely with some of the biggest luminary sites across the globe. So these institutions have tested many AI solutions and decided to adopt Gleamer at the end in their clinical routine. And of course, to work with some of the professors to help us develop our solutions, because our AI solutions are built from the radiologist to the radiologist at the end. All of these factors allowed us to have the biggest AI deployment today with more than 1,500 institutes across the globe that are using our solution in clinical routine. And we have an impact on more than 20 million patients today in clinical routine. So what we have built at Gleamer is the AI Copilot. We started our journey with a main focus on X-rays, and these are the most known solutions for Gleamer, especially the trauma solution, bone view trauma. We developed even more solutions covering more of your activities, such as the measurements, so bone metrics, the bone age, and also a chest X-ray solution. All of these solutions are CE cleared or even FDA cleared, deployed worldwide, and our vision today is to develop more AI solutions to cover more of your activity. With this, we know with one single provider, we can offer you one single user experience at the end, covering all of your activity when it comes to radiology. So we're working on a mammo and tomo solution, and also bone metastasis for CT and lung nodule detection on the CT as well. If I start with the first solution that we have, which is bone view trauma, it's designed not only to detect fractures, but also effusions of the elbow, knee, and ankle. We can also detect dislocations and also the bone lesions. We're covering all the body parts below the neck, so the limbs, pelvis, thoracolumbar spine, and the rib cage, and we are FDA cleared for both adults and pediatrics. So we can start at any age from 2 years old. Regarding the design, it's a really straightforward, easy design. We decided to rely on color coding because we know for a fact that the brain can actually process quicker the colors than the words, and that's why we distinguish between yellow and blue colors for positive or negative. The way it's integrated, it's really easy. So let's imagine that's your PACS viewer. First, you get the native images, which is untouched by the AI, and then you get the Gleamer summary table, showing you whether the exam is positive or negative based on the AI result. We also show you what we have looked for and found, and what we looked for and did not find as well. If the exam is positive, you get the additional images with a bounding boxes showing you where the pathology is located. Regarding the performance, as I was saying, we really rely on clinical studies, and we did this study over 3 months from 17 centers in Paris, where we picked up all the trauma cases that radiologists are actually reading in clinical routine. Over 5,000 cases, radiologists identified 668 fractures on 561 positive patients. We did a retrospective study with BoneView, and we had senior MSK radiologists to confirm the ground truth. And what we actually found that the AI was able to pick up 886 confirmed fractures. On the other hand, the AI missed 17 that the radiologists found and we missed. That's why our sensitivity is 97.8% and negative predictive value is 99.5%. These two numbers are really important because they highlight the efficiency of the AI on the positive exams where we know we're going to help you find more fractures, but also on the negative exams when you start building the trust in the AI that we're not going to miss anything, you can go faster on those exams. On the other hand, we had some false positive, of course, because no AI solution today is perfect. And our specificity was 88%, so we had almost 500 false positive on all the cases, which were easy to dismiss. And most of the false positive were doubtful fractures that the AI have picked up. The second solution we have developed is bone metrics. So this solution is actually not a diagnostic tool, but more a gain of time type of tool. How it will work is really simple. Today, you're doing manually the measurements by yourself. With those solutions, you can expect to have the results automatically pushed within your PACS in 1 minute. So instead of having to do the measurements, the AI can compute the measurements, indicate the reference points, and also the name of the measurement that were computed in a table below. We do have a long list of measurements, such as the feet, the spine, the legs, the pelvis, and hips. And of course, it's a dynamic solution, so we always add new measurements, and it takes us 3 to 4 months to always add new measurements. So recently, we added the shoulder and the knee as well. Third solution is the bone-age solution. So it's relying on the Grealish and Pyle Atlas. It requires only a frontal-hand acquisition, and you will automatically get the AI computed age within your PACS system as well as DICOM secondary capture. So no need to also perform this task manually anymore. Final solution is our chest view solution. So it's designed to detect the pneumothorax, the consolidation, effusion, nodule, and mediastinal masses. We cover all types of acquisitions, so the PAAP, bedside, frontal, and lateral view. And it's designed for patients above 15 years old. It's not yet cleared for the patient on pediatric because it's quite hard to get some chest x-rays on pediatric, but this is a project we are currently working on in Paris as well. The way it works is really simple. First, we have the native images, which are untouched by the AI. And with the same summary table, same color coding, you will get your results with the positive or negative, and the bounding boxes showing you where the pathologies are located as well. Final point I would like to discuss, which is really important today, is the integration. So we always hear how hard is it to get integrated within your PACS. So what you should expect from Gleamer is an additional modality pushing DICOM secondary captures. So we can integrate within all PACS systems. We are really PACS neutral, and the way it works is automatically in the background. So normally the X-ray goes from the modality to the PACS. We will have DICOM communication with this PACS system, automatically pick up the X-rays, process them, and send you back the results within your PACS. Because we know how much you hate additional clicks, so we decided to develop a solution that doesn't require any clicks from the radiologist. The main benefits that we see from our AI today in radiology department is definitely reduction of waiting time, especially in emergency department. And on this, we heavily rely on our very high negative predictive value that could allow you to discharge the patients faster instead of waiting in emergency department. The reduction of any medical complications. With the AI, we know we're going to help you find more fractures and reduce the number of missed fractures, pneumothorax, or the nodules as well. And of course, finally, the faster turnaround time. For the faster turnaround time with AI, it's really important to note it will not happen in the beginning, because when you first use a tool for the first time, you want to study that tool. You want to make sure that it's behaving well. So you will actually spend maybe more time analyzing the images. But once you build that trust in those tools, that's when you will allow yourself to go faster on those exams. Thank you.